Good evening, class. Dr. Townsend. I'm here presenting my senior practicum project based on care planning. So in order to create my project, getting started, I talked to my project mentor. I spoke with my unit manager about current needs of the department. A few of those needs that I did some research on and felt like might be a good place to educate might be glycemic control, uh, giving insulin and checking blood sugars and things like that on the unit. This is a psychiatric unit, so some medical problems I felt like uh, could use some better teaching. I had an ostomy patient on the psych unit, which was very interesting. We were able to obviously give care to that patient, but I felt like maybe a refresher would be nice for us on the psych unit. However, speaking with my project mentor and my manager and my department, care planning was what they recommended. The care plans on the unit were very difficult to understand. As a new nurse on the unit, I started my psychiatric career, just in November. So I came from the OR before then, and we didn't really use care planning in the OR. The OR is based mostly just on the current operation that might be going on. So care planning was something that was very new to me, other than learning about it a little bit in school, but not actually doing care planning in the EPIC system the way that we do it on my unit. So I had to gather information. I did research on care planning. Care plans is something that is based off the current needs of the patient, based on admission. It's something that needs to be given focus by the nurse, because the care plan is what the patient takes with them. It's the education that you give to them, so that way they can self-manage their disease. It's very important to the psychiatric patient, because when they come to us, they're very distressed. They're very acutely affected by their diagnosis, and they're not managing their disease typically very well. So if we're able to educate them on their medications, proper self-management, then they might be able to better control themselves. And whatever landed them in the psych ward, most of our patients are brought in by the police. So whatever landed them there, they might be able to better manage whatever symptoms and things might be going on with them to help them in the future. So I learned in my research that the care plans are very important, as we already know. These giving the patient a better outlook and involving them in their care keeps them more active with their self-management, and it keeps them involved. So I created a PowerPoint based off of this research that I did, and also based off of some research that I did in the EPIC system, better trying to understand how our care plans are formatted, which our care plans are done based off of templates that you add based on the current needs of the patient. So if the patient has like sexual precautions, elopement precautions, maybe assault precautions, suicide precautions, things like this, you can add those templates to the patient's care plan. The care plan needs to be the current needs of the patient. So one thing that I noticed was that some of the templates on the patient's care plan were not current, as far as, say, maybe the patient was in our hospital and had very aggressive or agitated behaviors prior to this admission, and maybe somebody looked in there and added that to their care plan. However, if they were there for something different, maybe suicidal ideation, or just acting strange, but they haven't shown any signs of aggression, then that doesn't need to be on their care plan. It needs to be the current needs of the patient. So obviously a suicidal patient will need suicide on their care plan. So when you add a template to the care plan, then you have to have two goals, two SMART goals, one long-term and one short-term per template. So another issue that I learned was that some of the goals, a lot of them didn't have a short-term and a long-term per topic, and they also uh, weren't smart goals. So smart goals need to be attainable while in the hospital. They need to have an end date. Um, they need to be something that the patient can accomplish while there, such as a suicide patient needs to be able to contact someone when they feel suicidal within the week. So our patients have phones on the unit. That would be a SMART goal, and then you can put a date at the end of it. That way, the patient has identified somebody who they can call when they are feeling distressed. That's one way to teach a coping skill for that patient. So another thing that I noticed is that the care plans had extra clutter on them. So some of our patients come from the medical ward. They might have the inpatient care plan template still on their care plan. So that's something that I considered clutter. So I found that a lot of the care plans were difficult to understand because they had information on there that was just extra information, and people were clicking multiple things and just adding them, but not adding SMART goals, and it might not really pertain to that patient's current needs. So I created a PowerPoint based on these things that I saw and this research that I did based on the importance of care planning and teaching SMART goals and EPIC, training for EPIC. I administered a quiz following my in-service. I also was able to do one-on-one training with staff members on the unit, which I felt like was more beneficial because we could actually interactively go through EPIC, and I can show them where some of the other care plans are falling short, and I can show them how to add and create SMART goals in the care plan with expected end dates. So I discussed with my manager following my presentation and my teaching, and she was pleased. It was her idea that I should do care planning. It was something that had been bothering her for some time, so I was able to help her with that teaching. So the staff that I educated all scored 100 on my 5-question quiz. I was able to evaluate the care plans for some time following the one-on-one teaching and the in-service that I gave. And I noticed an improvement in the care plans, some of the clutter. I created a log based on 4 things. One would be that the long-term and short-term goals there per topic, that the care plan is based off the patient's current needs. I also evaluated it for clutter to see if the care plan had only information that was needed on it. This is because if someone is looking at the care plan, maybe a new nurse on the unit or just a new nurse that has floated to our unit and they're looking at these care plans, they're not gonna be able to understand them if it's all cluttered with information that the patient doesn't need. So I evaluated based on that, and I also evaluated the care plans based on the expected end dates being there, because that's also been another issue. And what I found was that the care plans had improved, and my manager was very susceptible to my teaching. The nurses on the unit, I still feel as though they might need some more education based on the care plan teaching, because they're not what seem to be taking the care planning very seriously, as far as they want to do what is required, but they still seem to think that care planning is a hassle at the end of the shift. When we typically do our care plans, we get off at 7, like most nurses, so we're allowed to start it at 4 o'clock, which gives you plenty of time to go through the care plan properly. So I made a recommendation for further teaching on care plans so that the unit doesn't fall back to where they were when I first started a few months ago. unable to understand the process of care planning. So I recommended that the staff be trained annually. I also recommended that the system Epic Playground be used to do our care plan teaching in. It's a system that we already used. It's more like a simulation of Epic, so you can pull up a patient that's not real, and you can go in there and chart things. And I feel as though it would be nice if we could do training where everyone gets a laptop and everyone is allowed to use the Epic Playground system and interactively create care plans. I also felt as though there needs to be clear and concise instructions, because when I started on the unit, a lot of nurses would tell me conflicting information based on the care plan. So it became evident that it wasn't clear what exactly was expected for the care plan, which I believe now has been cleared up a little bit more, and our care plans are improving. So thank you for your time.